Diabetes. What do you know about diabetes? Do you know that exercise and food play a huge role? Do you know your risk factors? Do you know that it's a chronic condition? Did you know it's silent at times? Did you know that it's one of the leading causes of mortality in communities today? Not only San Joaquin County, but the United States is increasing its number in diabetes. And there are a few key things that we can do to protect ourselves. But do you know? Is there resources out there? Do you know about these resources? Well, we're here to help you. We're here to help you understand what it is, your risk factors, things that you can do yourself to protect yourself against diabetes. And also, if for any reason you do become diabetic, what resources are out there or some changes that you may be able to make to help you. Did you know that that muffin you eat in the morning might be slowly killing you? All right, so type 2 diabetes. We're going to learn a little bit today. When you hear type 2 diabetes, you might think sugar, 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 sugar. Well, sugar does have a big part to do with it, but carbohydrates do too. Carbohydrates is what your body turns into sugars that your body can use for energy. Well, if you put too much of that carbohydrates and sugar into your body and not the right ones, you can become overweight. And when you become overweight, you are at risk for type 2 diabetes because your body just doesn't know what to do with this excess sugar. Diabetes, you can have silent damage. There is retinal issues with eyes, there's kidney issues, there's blood vessel issues. You can have neuropathy in your feet because of irritation to the nerves. It is progressive. Unless you make changes, progressive means it's going to get worse. It's going to cause more damage. You know, there are a few things that you cannot control, such as genetic factors. If someone in your family has it, you may be more apt to get it. There are things that you can control, such as lifestyle factors, which we'll talk about in a little bit, that you can control to reduce your risk. Type 2 diabetes, unlike type 1 diabetes, which your insulin doesn't work at all in your pancreas. Type 2 diabetes is progressively where your insulin resistance. Your body just doesn't use the insulin like it used to. It's got some damage, or it's, got too much sugar built up into fat and too much storage to where the insulin, you need more of it to do the same job before. There are some ethnic risk factors. For example, African Americans are at a disparity for this disease. So screening is really, really key. There is controversy whether or not type 2 diabetes is reversible or not. So prevention is key. If you are diagnosed, if you're pre-diabetic, making changes can stop the disease process. For a community which diabetes has devastated, a community with lots of resources can provide a lot of help to these patients, to these people, to you, to your family members. With a community that lacks the resources, such as small rural communities, such as the one that I live in Oakdale, or the ones in San Joaquin County that are very small, lack of health care, lack of proper education can really be major issues. Some of the things that the community can do that lack resources start at simple tasks. Improving understanding of risk factors. For example, handing out flyers at doctor's offices, putting an ad in the newspaper, the local newspaper, that improves education, improves understanding of diabetes type 2 and what your risk factors are, can extremely help and can be cost effective. education for those diagnosed, giving patients community classrooms or information to who that they can talk to regarding making changes or the whole new lifestyle that they will have to live because they were diagnosed with diabetes. Health education programs and physical education programs at the school, starting education at a young age regarding risk factors and understanding of the disease can extremely help. Young minds can bring that home to older minds and help make a change. Also, any resources available, people need to know. Communities can provide lists of resources to people. Again, they can put an ad out in the newspaper. They can put flyers out at your local grocery store. They can put flyers at doctor's offices for resources local, online, and worldwide. So patients and people and family members know what help that they can get once they get this disease or to prevent it.
How limited resources affect the community. So, good nutrition plays an important role in the optimal growth, development, and health of individuals in all stages of life. Healthy eating can reduce the risk of chronic diseases such as diabetes. So, for many people in underdeserved communities or communities with limited resources, having a poor diet is usually not a choice. With limited resources, the community lacks healthy, affordable food options and tends to attract cheap, convenient fast food restaurants instead. These fast food restaurants serve food loaded with salt and sugar, leading to a poor diet, which over time contributes to the risk of developing health problems. Communities with limited means tend to not have access to resources to learn about science, health, and exercise. Education plays a crucial part in living a healthy and active lifestyle, and not being taught the importance of eating a healthy and balanced diet, accompanied by maintaining regular exercise, leads an individual down a path of increased obesity and chronic diseases. So, if poor access to healthy food, limited exposure to health education, and the importance of exercise is not enough, the cost of healthcare makes it difficult and a lot of times impossible to have for some people. If individuals cannot afford to go see a doctor, they are not getting those regular checkups that help find health issues or potential health issues before they become a problem. And last but not least, expenses. Diabetes is a costly expense. Not having insurance or having insurance with high deductible health plans that may or may not cover the costs of doctor visits, test strips, and medication keeps people from getting the help, care, and often the supplies that they need. In 2016, 1 in 4 people with diabetes were either skimping on their medication or skipping them altogether due to the costs of supplies. On this slide, I have some signs and symptoms listed of type 2 diabetes. So, some early signs of diabetes would be hunger, fatigue, peeing more often than usual, excessive thirst, dry mouth, unexplained weight loss, blurry vision, and dizziness. So, some symptoms that show up after your blood sugar level has been high for some time would be things like yeast infections, slow healing sores and cuts, pain or numbness in the feet and legs. So, some risk factors that can lead to diabetes are weight, obesity, inactivity, age 45 or older, a family history of diabetes, race, high blood pressure, high cholesterol, and smoking. So, some preventative measures that you can do to prevent diabetes include staying active, super important, losing weight, drinking water as your main beverage, trying to eat a healthy diet, watching your portion sizes, and quit smoking are all preventative measures to keeping diabetes at bay. Community based programs addressing diet, physical activity, and health behaviors have shown significant benefits on the prevention and management of type 2 diabetes. So, here I've listed a few programs in the San Joaquin County area that offer many resources that are available to the community. So, I have Unite for Diabetes. I have St. Joseph's Medical Center, and they offer a great program that's called DEEP. I have Public Health Services of San Joaquin County. They offer an obesity prevention program. And then Community Connections Health Education offers information for the American Diabetes Association. So I will let my fellow nursing student Gabriel explain a little bit more in detail how these programs and facilities help our community fight diabetes. Thank you.
Thank you, Kayla. So by now, you might be asking yourself, how will these local health resources benefit the community? Well, these resources address multiple areas of interest such as education, prevention, public empowerment, culture change, reducing illness, improving quality of life, and reducing healthcare costs. Education is achieved through teaching the public about what is diabetes, recognizing the early warning signs, as well as learning all about your risk factors for prediabetes and type 2 diabetes. Prevention through goals of stopping diabetes before it starts, with resources that give tips on how to prevent diabetes. Public programs are also offering diabetes risk testing to assess your risk for getting diabetes. Empowerment of the public to recognize we have the power to prevent diabetes, where there are steps you can take to get started today, which in turn leads to a culture change. A culture change happens when lifestyle changes are made to improve an individual's health and set new healthy habits for future generations. Reduced illness is achieved when we decrease the prevalence of diabetes as well as a decrease in the complications of diabetic crisis. This leads to an overall improved quality of life. All the programs are intended to support the public in preventing and managing the disease. Reduced healthcare costs come when proper prevention and symptom management leads to relief for the patient, as well as a reduced burden and expense on the healthcare system as a whole. So now we reflect on what we learned. So, what did we learn? We learned what diabetes is, how to recognize the risk factors for diabetes, how to recognize the signs and symptoms, and how it affects the public. We learned diabetes is preventable for most people who are diagnosed with it through proper education and early intervention. We also learned there are many great public resources available at no cost. These local programs exist to help the public prevent the incidence of diabetes and to manage symptoms of diabetes, as well as to reduce complications associated with the illness. We also learned that with certain lifestyle changes, people can avoid developing diabetes, and for people who are already diagnosed with diabetes, adopting lifestyle changes along with an adherence to a medical regimen can result in a normal life. So, diabetes is recognized by Healthy People 2020. Healthy People identifies public health priorities to help individuals, organizations, and communities across the United States improve health and well being. Healthy People 2030, the initiative's fifth iteration, builds on knowledge gained over the first 4 decades. Healthy People provides 10-year, measurable public health objectives and tools to help track progress towards achieving them. These Healthy People 2020 objectives were carefully chosen based on the national data. Goals are set to promote, strengthen, and evaluate the nation's efforts to improve the health and well being of all people. When we work together to achieve them, we can improve health and well being nationwide.